Good morning. Welcome to the National Climate and Health Forum on the third day of the American Climate Leadership Summit. I'm Leila McCurdy, Chair of the Climate for Health Leadership Circle Executive Committee. I'm so inspired by the amazing leaders we heard during the first 2 days of the summit, and I can't wait to listen to our outstanding Health Forum speakers today. I'm joining you today from Arlington, Virginia, on the traditional lands of the Piscataway, Pamunkey, Nanticoke, Anacostan, and Patawomac peoples. I'm delighted to be here with Rabian Mackin, Chief Development Officer at Eco America. Good morning, Rabian.
Good morning, Leila. I'm pleased to be joining you as well and welcoming us all to day 3 of the American Climate Leadership Summit. I'm joining you from the Hudson Valley of New York on the ancestral lands of the Mohican and Munsee peoples. I look forward to diving into our theme for the day, climate and health. But first, Leila and I agreed that we can't start off today without acknowledging the heartbreaking situation in the Ukraine. The atrocities we are witnessing, the horrific images we're seeing are creating a feeling of powerlessness in many of us, even though there's an outpouring of worldwide support. As empathetic humans, we imagine what the Ukrainians are experiencing and wonder how we can help. This crisis is layered on other crises and creating anxieties in our everyday lives, from climate change and its impact on our physical and mental health and our future, to the COVID-19 pandemic and the physical and psychological toll this has taken on our communities, as well as the distressing amount of oppression that people are experiencing in places all over the world.
Yes, Robbie, and now more than ever, we need to stay resolute in our commitments to ensure that we are all protected, especially the most vulnerable in our communities. We must act now to create solutions that focus on health equity that will have cascading and synergistic benefits for all. Using a social determinants of health framework, we know health is not just absence of disease. We know that where we live, our race, our income, and education all have impacts on our health. This needs to be a guiding principle as we craft climate solutions.
Absolutely, Leila. And at Eco America, we believe climate change is about people, with health as one of the most important aspects. Eco America's Climate for Health program partners with many of the largest health membership organizations and institutions across the country, like the American Academy of Pediatrics, the American Public Health Association, the American Psychological Association, and many others, reaching out to more than 1.4 million health professionals. We're focused on collaborating with our partners to help them visibly lead on climate and engage their members to do the same. Our work is rooted in building public support and political resolve for climate solutions that advance health equity and address environmental injustices. Eco America and Climate for Health provide strategy, communications guidance, training, and resources tailored to the health community leaders and their affiliates, like our Let's Talk Climate weekly webcasts and action guide, the Moving Forward Guide, and our newly released Mental Health and Our Changing Climate Report, all of which are easily accessible and available online at our website at no cost.
That's right, Rabian. Climate change is an urgent public health issue, and health professionals are trusted leaders who play a critical role in the advocacy for solutions. We are seeing the impacts of climate change in our communities today, and the toll on our physical and mental health is increasing. At the same time, though, health is a major motivator for climate action. The health sector has a tremendous opportunity to lead on climate and influence broader audiences to protect their health and our climate at the same time.
I agree, Leila. We're all feeling and seeing the health impacts from climate change, and Americans trust health leaders for climate information. The time is now for health professionals across disciplines to work with their peers, patients, and policymakers for healthy people on a healthy planet. Today, we'll hear from ambitious climate leaders about national initiatives prioritizing climate and health, learn about different aspects of climate justice and health equity, and hear directly from local health leaders implementing climate action. We would also like to make sure that all of you joining today get the most out of our program and our live stream platform. Be sure to explore the reception area on the left, where you will find the full agenda for today and speaker information. Also, be sure to check out the networking section during breaks and participate in the 10-minute networking session halfway through the day. You can also follow along with the conversation online with the hashtag ACLS22.
Absolutely, Rabian. Jump into the chat to introduce yourselves and connect with fellow attendees throughout the day. And don't forget to ask our speakers, our fellow audience members questions or respond to polls. This will be an exciting day, and we look forward to engaging with you in all the many ways that are available on the Summit platform. Now on to our program. To kick us off, I have the honor of introducing our opening keynote speaker, Dr. Arthur Evans, Chief Executive Officer of the American Psychological Association. APA has been a longtime partner of ECHO America, and we have had the privilege of collaborating with them on 2 reports on mental health and climate change. Dr. Evans has served as the CEO of the American American Psychological Association since 2017. Before coming to APA, he served as Deputy Commissioner of the Department of Mental Health and Addiction Services in Connecticut, and then as Commissioner of the Department of Behavioral Health and Intellectual Disability Services for Philadelphia. He received his doctorate in clinical and community psychology from University of Maryland and has held faculty appointments at Yale University, Drexel University, and the University of Pennsylvania. For his contributions as a public health leader, Dr. Evans has received honors from the White House Office of National Drug Control Policy, the American Medical Association, and the National Council of Behavioral Health. Welcome and thank you for joining us today, Dr. Evans. The floor is yours.
Hello, I'm Arthur Evans. I'm the Chief Executive Officer of the American Psychological Association, and I want to thank you for inviting me to speak today during this year's American Climate Leadership Summit. You know, climate change is one of the most pressing and important societal issues that we face. And it's not just a meteorological phenomenon. It has implications for people's overall health and well-being. And in particular, I want to talk about the mental health aspects of climate change. Existing research shows that there are both direct and indirect effects of climate change on people's mental health. For example, we know that people experience trauma after surviving a natural disaster. That would be an example of a direct effect. But we also know that there is anticipatory anxiety for people who live in areas that are affected by climate events. That would be an example of an indirect effect. We know that roughly 20 to 50% of people exposed to an extreme weather disaster are at risk of adverse mental health challenges. Up to 54% of adults and 45% of children suffer depression after a natural disaster. And mental health challenges associated with natural disasters can have a long-lasting impact. For example, people exhibited symptoms up to 12 years after Hurricane Katrina. Overall, this tells us 2 things. One, that these events can significantly affect large parts of our population, and that we can expect that there will be a long tail, a long-lasting impact when these events occur. So the question for us is, what do we do about it? We can focus solely on treating the mental health challenges related to climate change, and while that's important, it doesn't go quite far enough. We believe we must focus both on the causes of climate change as well as its impact, and that psychology must play a pivotal role in these efforts. So let me talk a little bit about the causes and how we believe we can bring psychological science to bear on these issues. One important thing that we know about the causes of climate change is that they are primarily driven by human behavior. And therefore, we must use the science of human behavior, psychology, as a part of our overall strategy to address these issues. And so I want to give you a few examples. I'm going to give you 3 examples of how we might do that. So one example would be the importance of incorporating the human element into our overall strategies and framing of the issue. We saw with the COVID-19 vaccine distribution that we spent literally billions of dollars developing the vaccine, developing the infrastructure to get the vaccine out to people, but we really didn't spend a lot of our time and effort at thinking through how would people understand the vaccine? Would that vary from different communities? How do we get people to accept the vaccine? And as a result, we didn't get the kind of uptake that we could have had we put the kind of time and energy into thinking about people and their acceptance of the vaccine up front and building that into our overall strategy when we thought about the distribution. Well, we can make the same mistake when it comes to the climate effort. It's really important to understand how people understand these issues, how people are motivated to engage in these issues, and incorporating that human element is going to be key to our overall success. And that includes everything from the language that we use to how we actually frame these issues and framing them in the way that incorporates people as a central part of our understanding and our strategies. Another example would be understanding human motivation around collective and individual behavior. We know the importance of mitigation and adaptation when it comes to the effects of climate change, and understanding human motivation when it comes to these issues is critical. Mitigation raises issues like how can we grow people's readiness and willingness to adopt new norms, practices, and technologies. We know that there is a body of literature around people's readiness and willingness to change. We ought to bring that to bear as we think about these kinds of questions. In fact, we know that a message that might be very effective for one person who's at one stage of readiness to change might be very different than the impact with another individual. In fact, it might be even counterproductive. And so bringing to bear that science and that knowledge is important in terms of our mitigation efforts. But when it comes to adaptation, we have a similar understanding that could be very helpful. It raises questions like, how can we promote individual and collective resilience? How do we reduce the effects of misinformation and disinformation about climate change? Well, there are bodies of knowledge around why misinformation and disinformation is impactful. And if we know that, we can use that to mitigate the impact of misinformation and disinformation. Answers to questions like these can help inform how we frame calls to action and how we actually are maximally effective in our efforts. A third example might be how we can use psychological knowledge to help shape the broader context for climate change. In large part, this means helping to reduce the actual and perceived psychological and physical barriers to engaging in climate change efforts. Let me give you a few examples of what that might look like. We know that reducing people's psychological distance from an issue can be very important. Raising the visibility of the real effects of climate change on people and communities is one way that we can help people to feel more personally connected, which is, again, very much tied to people's willingness to then engage around an issue. Reducing burdens on people's decision-making. Psychology, we talk a lot about cognitive load. If we can reduce people's cognitive load as it relates to their decision-making, it can help facilitate the desired behaviors that we are looking to affect. So opting out of something or using strategies where people have to opt out can be much more effective than having people to opt into doing something. Using positive reinforcement is more effective. And in fact, we know that the negative framing of issues related to climate change have been found not to be as effective as using more positive strategies. Improving people's sense of self-efficacy around these issues is also important. Improving people's beliefs about what they have the ability to do, and helping people to understand and see how they can have more control over these issues is another strategy. So overall, taken together, these are just some examples of how bringing psychological knowledge into this area can be important in our overall strategy. So the issue is, given all of this, how do we develop our solutions? There are some of the solutions that are going to require us, psychology as a field, to change, but there are also some solutions that are going to require our collective action. One of them, for example, is acknowledging that there are important mental health impacts and that we have to take that into consideration as we think about this issue. We know that and recognize that mental health challenges and impacts like the ones that we've described take place among diverse groups of people who are in diverse circumstances. And therefore, our solutions must acknowledge that complexity and diversity, and we must ensure that there is climate justice. And in fact, I would go as far as to say that if we're going to be effective, we have to understand and recognize and appreciate human diversity, and center climate justice in our overall efforts. That is what is going to allow us to have maximal impact. But there are also some things that we as a field, psychology and those of us in the broader mental health field will also have to do. One of them is recognize that we as a field have historically worked at the individual level, and we've essentially waited for people to come to us after they have a problem. We diagnose them and then treat them. But if we're going to be effective on this issue, we're going to have to turn that paradigm on its head. We're going to have to work not only at the individual level, but we're going to have to work at the community and population level. And we're going to have to develop new kinds of interventions for working at that level of analysis. But we also have to work further upstream, that we can't have just a passive stance that waits for people to come to us after a problem, but we have to get further upstream, intervening much earlier, developing programs to build resilience in communities, for example, and earlier intervention programs in the immediate aftermath of climate events. So we know that we have some work to do, that we have some new systems, new infrastructure, new training that we will have to do in order to be a good partner in these efforts. And we're willing to do that. And so APA stands ready to help to address these issues. We want to bring behavioral science to these overall issues, clinical knowledge to the issues of addressing the impacts of these issues. And we stand ready to work with all of you on helping to address climate change in our nation. Thank you for listening, and I hope you enjoy the remainder of the summit.